from that disease, because you can cause some of the mental health issues. Yeah, you can cause some of the mental health issues. We should not stigmatize these people. They are like us. Everyone can suffer from gonorrhea. So gonorrhea is a treatable disease. It's not it's not like HIV that yeah. It's just a common disease like malaria and some of the diseases. So it's not good to discriminate these people.
So can you also differentiate STIs with a gonorrhea? How is it be differentiated from other STIs disease?
Uh, okay, the issue is about symptoms.
Okay,
Yeah,
okay.
yeah.
In other words, you are trying to say that.
And the causative organism, which is gonorrhea is caused by a bacteria which is called Neisseria gonorrhoeae. So the other STI which are caused by some of the organisms, except gonorrhea.
Okay, in other words, you're trying to say that a person who is struggling from this disease cannot show signs and symptoms similar to the person who is struggling to syphilis.
Okay. Yeah. Okay. Yeah.
Because we have been hearing that STIs, STIs diseases have a similar symptoms.
Yeah, they have similar symptoms. Yeah, but here in Mali, we cannot just conclude that this is gonorrhea. We just treat them as an STI. We don't conclude that this is just gonorrhea. We just treat them as they are.
Okay, we have also been hearing that a person who is struggling to gonorrhea, he or she is supposed to go to the hospital frequently. So, how often should someone be tested for gonorrhea, and what are the recommendations?
It's possible for them to be tested for gonorrhea if they are experiencing the, the symptoms of gonorrhea. There are some tests that are conducted in our laboratories. There are some tests, yeah. He can be tested, but mostly we just treat them according to their symptoms. We don't go further for lab tests because of we don't have some of the equipments which are used in our labs. We just treat them as they are.
Okay, so is it okay that the person struggling to this disease, he is supposed to go to the hospital or for him to be tested for several times?
Yeah, it is possible in other countries. It's possible. You can go and be tested for gonorrhea. Like, if you are suspecting that you have it, because or maybe you had a sexual intercourse with someone you are suspecting that he or she is having gonorrhea, you can go for test.
Okay, we have also been hearing that gonorrhea can be prevented through vaccination. Is this information clear that a person who is struggling to gonorrhea can get any vaccine which can help to prevent this disease?
I've never heard about vaccines, but for other STIs for other viruses like the human papillomavirus, there are vaccines. But with gonorrhea, I've never heard about their vaccines. Maybe are there, but here in Malawi, we don't have those vaccines.
Okay, okay. Maybe so you have also been hearing that vaccine most of the times disturb any medication that a person is receiving. Is this information clear? Just because you are a specialist, you know, you know the consequences of vaccine.
A vaccine that does not interfere with with certain drugs, unless if the person receiving that vaccine is not eligible for that vaccine because of some of the health issues. Maybe his immunity is very low. A person with low immunity cannot specifically given vaccine.
Okay, we have also been hearing that gonorrhea cannot be controlled when person is suffering from HIV. So how can a gonorrhea be managed in people with HIV, which with HIV and other SIs?
They found that gonorrhea cannot be treated with the HIV infected individuals. It's just a lie. It's just a rumor. Anyone who is suffering from an STI is whether he's living whether he's living with HIV, he can be treated. He can be treated as anyone else. So we don't divide them that this is suffering from HIV. Let us not treat him from an STI or gonorrhea. No, we treat them as they are.
Okay, in other words, you're trying to say that people who are suffering from gonorrhea should feel that their disease can be controlled, can be managed. They should go to the hospital so that they should receive a medication.
Yeah, like any other disease, they can be treated. They can be treated.
Okay, we have also been hearing about antibiotics. So, what is the role of antibiotics in treating gonorrhea?
The role of antibiotics is to kill the causative agent, which is also a bacteria. Yeah, so we treat STI, we treat gonorrhea with antibiotics because are also caused by bacteria. That's why we give antibiotics. So the role of antibiotics is to eradicate the causative organism of gonorrhea.
Okay, can gonorrhea be cured, and what are the chances of the occurrences? We have been hearing that a person who is suffering from gonorrhea, after recovering from this disease, there is a high chances of recurring of the disease.
Yeah, there are some cases of disease recurrence which are due to maybe treatment failure, maybe or drug failure or resistance. It is possible for a recurrence. So we have drugs which we use in cases of treatment failure or resistance or drug resistant. Yeah, but gonorrhea is treated, but the percentage of drug resistance or recurrence is not that high. is just a low percentage. For recurrency, sometimes it is caused by maybe if 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 that person is not uh, is maybe having other sexual partners, maybe he has contracted an infection from someone else. Yeah, they can be a recurrence despite being treated. Yeah.
Okay, I think gonorrhea can also can be prevented. What are the ways of preventing in gonorrhea?
There, yeah, there are some ways of preventing it. The, those ways are just common, like in HIV. Yeah, we have we the first way is abstinence. Yeah, abstinence is one of the way of preventing gonorrhea. The other one is use of condoms, use of protection when having sex, and the other one is having one trusted sexual partner or partner. Yeah.
Okay, can gonorrhea be prevented through use of PrEP?
PrEP, no, no, you cannot you cannot prevent it from using PrEP. No, because PrEP is an antiretroviral therapy, antiretroviral drug, which does not deal with bacteria. Yeah, PrEP is just used to prevent the spread of HIV, which is a virus. So some people they have that mandate that if they take PrEP, it means that they are protected from STI or gonorrhea. No, it's just a lie.
Okay, what are your advice you would like to provide to the people who are believing this information that the gonorrhea can be also be prevented through PrEP?
Uh, yeah, it is not possible for you to prevent gonorrhea because gonorrhea is a bacteria. So if you take PrEP or PrEP, those drugs are viral drugs. They don't deal with bacteria. So it is impossible for you be to have full protection from gonorrhea uh, just because you took a PrEP or PrEP.
Okay, so we are approaching to the end of our program. What are the treatment options for gonorrhea you provide to the people who is struggling to this deadly disease gonorrhea?
Uh, there is a treatment formula which we use now. Yeah, in the past we were using which this drug called gentamicin, but due to the issue of drug resistance, it was changed to it was replaced with this antibiotic. We call it ceftriaxone. So we give we, we give this drug ceftriaxone 250 milligrams injection. Then we give fragile or which is metronidazole 2 grams 2 grams starch oral, and then we give azithromycin, 1 gram starch. For pregnant women, we substitute